Yes, thank you so much for watching. So our next video or today's lecture, we are going to talk about dental abscess. Well, I know when we talk about dental abscess, the word pus comes in your mind, and it is true. We are talking about things connected with pus in the oral cavity, and we are saying that this is what we call what dental abscess. We are saying collection of pus around the teeth that spreads around the tissue. And you know what means by pus. Pus, when we are having a fight between white blood cells and the white blood cells of the body, and of course bacteria, we shall have a point where the white blood cells are weakened. When the white blood cells are weakened and they die, we shall have what? Pus. So we are saying that here the pus is a thick yellowish or greenish opaque liquid produced in the infected tissue, consisting of dead white blood cells with tissue debris. And of course the common bacteria is Streptococcus what? Aureus. We have three types of abscesses. We have the one called gingival abscess, we have the one called periodontal abscess, and the one called periapical. Remember, we said peri means around. So when we say the gingival, we can think of the gingiva. We say the perio, it means around the tooth, periodontal abscess. When we also say periapical, we also mean peri, around the what? Around the tooth. Let's go in explanation. Gingival abscess. Here we have the pus or the affected area is only the gum tissue. It does not affect the tooth, it doesn't affect the what? The periodontal ligament. It means that the moment you solve the problem of the gum, the area around the gum will not be affected. For example, if this is our tooth, of course we have also periodontal, we have a periodontal ligament. The problem we have here is the gum. Something should have traumatized this gum. Maybe a toothpick, maybe a wound, maybe anything, maybe a bone, a fish of the bone. A bone of the fish. Anything could have traumatized this gum. Maybe any wound that is caused by any other disease. But what we are saying is that it is only the gum that is diseased, and it is now causing what? An abscess. It means that the moment you solve this problem, someone will be okay. The periodontal ligament here in blue and the green, the alveolar bone, they are very fine. The tooth is very what? Is very okay. The dangerous place is here in red, where we have the what? The abscess. So, what can be the another one? The other one is periodontal. We say the perio means around, and now what we are having is the pus has spread around the what? The tissue in this area. Usually this is because of poor oral hygiene. What we talked about, maybe it can even result from chronic gingivitis. When there is poor oral hygiene, there is always what? Bacteria around there. From poor oral hygiene around there. So we are saying this spreads in the surrounding bony tissue structures. Both the gum and periodontal ligament are affected, and the infected are affected and infected, and spreads around the what? and separates from the tissue. This is what you're talking about. From this area and this. All this is what we are talking about. We said also in this one, which results from poor oral hygiene, we have also the periodontal ligament affected. We have the pockets formed. We said in the previous video that a pocket is a diseased gingival crevice. We said that a normal gingival crevice is this one here between the tooth and the gum, and it should be between 2 to 3 millimeters. So the moment we are having a pocket, it means this area is affected. After it is affected, we are having a pass around this area. It means that the moment we solve the problem in this area, a patient will be okay because the tooth is not affected. The pocket, yes, is formed and is difficult to clean. The moment you do percussion, horizontal percussion, of course, there is vertical percussion and horizontal percussion from the sides. So if you percuss from the sides, you are going to have a positive response. Periapical. Periapical means here, around this area. So the previous set was the gum. Now we are having issues. The hole, maybe there was a hole in the tooth and there is bacteria from the enamel through the pulp tissues up to when it is coming through here. And the bacteria can be seen as what? As swelling around here. So bacteria came from here, and of course is now manifesting as a swelling around the what? Around the tooth. So, but it is from what? The tooth origin. So it means now, that's why you are saying it starts from the soft pulp. It requires dental treatment. And this one, the moment you do vertical percussion or percussing on top, it is going to be what? Positive. What are some of the signs? The signs of this one is throbbing pain. Dental abscess has throbbing pain. Swelling. Of course, swelling is obvious because the gums are inflamed and they are swelling. Someone has a swollen cheek, shiny in appearance. Halitosis passes many, so you shall have bad breath from the oral cavity. General malaise, that is fever. Trismus. Trismus is inability to open the mouth well. We shall note that there is a difference between trismus and rima oris. Trismus, we are unable to open the mouth because there is swelling or if there is a broken bone. But for rima oris, someone is having that congenital small opening of the what? Or the oral cavity. But for this one, we are having what? Trismus. Difficult in swallowing, of course, tender on percussion, we talked about that. In your questions, they're always going to be giving you that a patient appeared. In your question banks, shall check this one. A patient appeared with a swollen cheek. On oral examination, you observed a grossly carious or a very carious tooth, maybe a 1-5 or a 3-5 or what? What could be the solution? That one, you mean that they are giving you an abscess and they are also giving you more hint that it was what? A diseased tooth. Sometimes suppose they give that a patient appeared with a swelling near the gum. On oral examination, you saw poor oral hygiene, especially around this tooth. Then you know now you are in what? Periodontal abscess. If they saw there was something stuck in the gum and there was a swelling around the gum, now that is what? Abscess. But whichever the abscess, the moment you tell us that it is a dental abscess, then we can connect it to what? Either gingival, periodontal, or periapical. That is what? Very important. What could be the treatment? The treatment of this condition or of abscesses is going to depend on the type of abscess we are having. For example, the type of abscess we are having. For example, if you have gingival abscess, we say gingival abscess, it is caused by trauma. Trauma. For example, if there's something which has traumatized the gum, for example, a bone, a toothpick, normal, maybe bacteria or another organism, and is causing swelling or pus around this area, you have to give antibiotics. You have to do what? Maybe you do incision and drainage, and you give a mouthwash or a painkiller, and it is what? It is done. That's why I talk about antibiotics and what? Incision and drainage. These two will work. If it is due to a gingival abscess and the gum is the one which is what? Solid. Now, if at all it is due to this area, the periodontal area, because we said periodontal abscess, the area around the tooth is affected. The tooth is not affected, but the periodontium is affected. What do we do here? You need to do scaling and polishing. Scaling and polishing, you remove what? Cariculus. You can actually also add something called root planing. Root planing, you remove the diseased cementum. You remove this up to here. All this area which is sick, you clean all this area. Of course, you give antibiotics. The patient will be what? Okay. Antibiotics and painkillers. When you talk about antibiotics and painkillers, as a student, you're supposed to tell us the antibiotics to give to this person. Do not say antibiotics, no. You need to tell us maybe if it is metronidazole, you say tabs, metronidazole, 400 milligrams, TDS, times 5 days. If at all it is Frucamox, you tell us you need the caps, Frucamox 500 milligrams, TDS for 5 days or 6 days, depending. But do not put just what? Antibiotics. Painkillers, you need to tell us which painkiller you think can help this person. If I thought it is a paracetamol, you put. If I thought it is a ibuprofen, you put. If it is diclofenac, you put. Plus, what? Do not say painkillers, as I'm stating here. So for periodontal abscess, you know the area which is affected is the area around the tooth. You need to do scaling, and I said scaling and polishing is superficial, but the one which is deep is what we call root planing. So you do root planing. And of course, antibiotics, these two will work. Then lastly, we talked about an instance where the tooth is affected. If a tooth is affected, of course, you do not have to stop here. If this tooth is affected, you have to do two things. We have to do two things. Number one is what we call root canal treatment. Root canal treatment Root canal treatment is that you cut on the tooth and you go as deep as this side and you remove all the diseased pulp. You remove all the diseased pulp. Of course, after under anesthesia, you remove all the diseased pulp, you clean there, you irrigate the area with maybe normal saline or hypochlorite. You irrigate and make sure the area is free from this bacteria. From after that, you shall cement the tooth well, and maybe you put a crown. That is what we call root canal treatment. If at all you don't do root canal treatment, another common one is extraction. Extraction is a complete removal of a whole tooth or root. Extraction is very common. There is a common mistake of someone saying the tooth is sick, but I cannot remove. Cyst is so big, I cannot remove this tooth in a swollen jaw. Let us give antibiotics to contain or to reduce the swelling. A very common mistake amongst our selves as health workers. We need to solve that one. So for periapical abscess, where the abscess begins from the bacteria from the tooth and spreads up to down in the soft tissue of the tooth and away from the tooth, this side, we call it what? Periapical abscess. We can treat it by extraction of this tooth, by doing root canal treatment of this tooth, alongside giving antibiotics and painkillers. Someone can ask, suppose I don't do this, what is likely to happen? You can have a problem of abscess complicating into cyst. A cyst of dental origin. We shall look at the cysts of dental origin, but the cysts of dental origin are many, ranging from radicular plus others. We have a full topic about them. A cyst where there was after granuloma, we can have a cyst. We can have chronic or acute osteomyelitis, where there is inflammation of the bone, either the maxilla or mandible of the oral origin. We can have cellulitis, where the inflammation of the soft tissue or around the face, which can result into swelling of the neck, the chest, stiffness of the neck, the tongue popping out when it is swollen and red in color, what we shall call as Ludwig's angina. We can also cause a blood clot in the skull as a result of infection moving into the area called cavernous sinus. We shall refer that condition as cavernous sinus thrombosis. We shall be looking at all these complications one by one in our next videos. Don't forget to like. Press the word like. Don't forget to subscribe and share with the rest of the students. Thank you so much for watching.